Hello, all you dinks of the Solar Federation. This is Dr. Jeff Horowitz, and this is Humpday Happy Hour with dentists in the know. We are your backstage pass for current trends, politics, and education in the dental world. We are live, as always, but you can watch us afterwards. And we are also very casual and over a little cocktail of your choice. We try to keep it light. We try to keep it fun. Tonight's episode is being brought to you by our friends at Spear Education. And with that, I'm going to tell you we have an incredible show. But before that, I want to introduce to you my two friends in dentistry, my only two friends in dentistry, the only two people who say they will hang out with Jeff Horowitz. No, I just want to introduce you to two amazing dentists and two great people, Dr. Jennifer Bell and Dr. Chad Duplantis. As you all know, we are all dentists, we are all educators, and we all own our own businesses. And our job is to bring all of you in the know.
Okay, so I do feel a little vindicated with this next story, and I hope maybe you will share some of this with me. So, there was an article that came out just this week that talked about the correlation between having bariatric surgeries, a variety, the sling, the actual closure, and et cetera, those different procedures that they do for weight loss and caries risk. And trying to make sure that when we're doing these surgeries for patients to help them through their BMI journey, that we are not inadvertently increasing their risk for other problems. Well, interestingly enough, this particular study out of the American Society for Bariatric Metabolic and Bariatric Surgery looked at 100 and some odd patients through a particular period of time to see what their correlation of caries was. So the interesting thing was the patients who had surgery prior to the surgery, they had a rate of 15 carious lesions on tooth surfaces, and that went up to 19.1 after surgery. Interestingly, though, the enamel lesions had decreased compared to those who had had the medical treatment. So for those deeper carious lesions in the dentine, patients had an average pretreatment initial value of 4.3 lesions. 2 years after treatment, that went up to 6.4, while those in medical treatment groups had 4.9. So the reason I bring this up is because I have seen in my own practice, there are some patients who will go through bariatric surgery, and it does appear that the oral environment is a non-event. We don't really have an increase in carious lesions. We don't have a decrease. It just sort of is status quo. But I've absolutely had patients that have gone through bariatric surgeries where it is almost a rampant increase in the activity in the oral biome. So I'm happy to see that institutions are starting to look at the connection. You could certainly, I think, highlight what GERD will factor into this, what the diet looks like when they move them to these liquid protein shakes, how does that factor in to their caries risk. But I absolutely think this needs to be studied, because then we're left with the liability to help manage these patients. And quite frankly, if the surgery is a contributory factor towards an increased caries risk, then maybe we should be looking at medical coverage to be able to help these patients get through after post-surgery. So I'm at least glad to see that institutions are starting to look at the connectivity between the two, and what we can do to help patients before surgery and after surgery, maybe to mitigate the risk of an increased carious lesion environment. It's been a hot topic for the week, but I thought we'd bring it up again. As we've discussed previously, Henry Schein has really been suffering with this cyber attack. You know, we saw this with the ADA, and it took them quite a bit to get back online and get back their data to be able to continue to move forward. And Schein appears to be no different. The particular group that did attack them has identified themselves as the Black Cat ransomware crew. And they have threatened to release a significant amount of data for stockholders and, related things with their financial relationships and agreements. And so we're now into week 4 of the cyber attack and no resolution. They are getting workarounds to be able to continue to process orders for clients. In fact, I saw an email from one of our reps locally here who was basically like, thank you and I'm sorry. And I was like, thank you for doing paper orders and I'm sorry you're having to do this. Thank you for putting up with the fact that you can't access your online portal. And I'm sorry you're having to do this. Essentially acknowledging that, we're going back a bit to be able to continue to stay in business. But we're trying to help you as best we can until we get access to our data again. And, I don't know what this looks like and frankly, scared to death if this ever happens to our company. So, hoping that they can find resolution soon. Last thing I wanted to remind everyone about is Veterans Day is on Friday. There are quite a few events going on across the U.S. where free dental care is being provided to veterans who are not eligible for VA benefits. If you happen to know about a program or are participating in one, kudos to you and what you're doing for our community and for our veterans who desperately need dental help, especially those who don't qualify for VA benefits. If you know about a program and want to post it into the community to drum up volunteering support, please don't hesitate to do so. We would be more than happy to share that information. Any way that we can continue to support our veterans who are, currently serving and post active duty, any way that we can provide dental support to them or just community support, we would be more than happy to do so. And with that, that's the news.
Listen, guys, we have such an incredible guest tonight that we do not need to be taking any more time away from him.
Yes.
So I know we've teased this. Spear Education is sponsoring our show tonight, but we have Dr. Gregg Kinzer tonight from the Spear Education Center. I mean, this is big. Let's get to what he wants to talk about because this is amazing stuff. JB, I loved what you talked about in the news because this is something I've actually been talking to our local bariatric surgeon about. I'd love to bring him on the show, Dr. Morris Washington, because we work so much together. I'd love to bring him on and maybe he could respond to some other side effects or potential side effects that could affect dentistry. I think it's just a great point. But Chad, would you like to introduce Dr. Kinzer?
I'd be honored. And Jeff, would you bring him up as I'm introducing him?
I'm happy to do it.
Dr. Kinzer received his D.D.S. from the University of Washington in 1995 and an M.S.D. and certificate in prosthodontics in 1998. He is a gifted, and I can certainly relate to that because I've seen him speak on numerous occasions, academician and clinician who is committed to advancing the art and science of restorative dentistry. His interdisciplinary approach to dentistry is founded in empirical-based research and clinical experience. Dr. Kinzer has a unique ability to impact complex clinical processes in a logical, systematic, and clear methodology that differentiates him from other dental educators. Dr. Kinzer obviously is with the Spear Education out in Scottsdale, and he has a private practice in Seattle, Washington with his wife, Dr. Jill Kinzer. And it's just a real honor to have you here, Greg. I'm sorry if I butchered that, but, I was trying to
that was a lot to get through.
Relate. I could have said probably half of it, but it's an honor to have you here, man.
Hey, I'm glad to be here. Thank you. Nice to see you all. I'm looking forward to this. I mean, I heard your, little Wednesday night cocktails, wine, and talking dentistry. Like, I'm in, all in.
Yeah. We're
it is the perfect combination.
It
and usually
absolutely
midweek, we need the wine, we need the camaraderie to sort of get us through the rest.
It's nerd night. Let's nerd out, man, because I mean, I love everything you guys are out there talking about and the way that dental education has really come around. Many of us have been fighting a lot of these battles on soul fronts, and so to see dentistry kind of coming together and really looking at a more holistic approach to treatment planning is absolutely refreshing.
Yeah, I mean, if you're in practice, I mean, we're in practice. I practiced all day, and it all revolves around treatment planning. It's the most important thing we do. I mean, for us to be successful in our craft, we have to treatment plan and do dentistry. But the challenge with that is not all dentistry is easy to plan, right? Some stuff easy, structure, restoration of teeth, replacement of teeth, pretty easy. But when you get beyond that and you have other problems, wear, airway, these types of issues, it's a little more challenging, and I think people get a little stuck. So it's all about treatment planning.
You know, I want to start with the basics, because the first question that I have is maybe a little bit different, but I have a how should I say this? I've grown into a huge appreciation for prosthodontists over the years. And, you know, that was, no offense, but the last residency that I wanted to do.
Me too.
When I graduated from dental school, I was to hell with this. What's a prosthodontist? You know, and then as I got into dentistry, I went to high school with three guys. You probably know one of them, the Hildebrand brothers, Jed, Brody, and Sloan.
Yep.
Sloan's a prosthodontist, Brody's orthopros, and Jed's an orthodontist. And I was like, why the hell are they going into pros, ortho, and pros? And, you know, ortho I could get, but, you know, now if I had to choose again, you always say, where would you go in life? To me, it would be pros or perio. And so those are the last two that I would have ever chosen. So what made you choose to go down the pros pathway?
Oh, no, I was going ortho. And if I said you're going to choose again, I would still choose ortho.
Really?
Yeah. I mean, listen, I enjoy what I do. I really do. And I enjoy helping others see their possibilities. Ortho is pretty sexy though, especially with the airway innovation, all the big changes from a health standpoint are ortho. But to your question, I actually did go to dental school to be an orthodontist, and actually in pros, second year, I was going to finish and then go back and do ortho. But I enjoyed the restorative side, and I kind of burned through my requirements quickly. I played a lot of golf, right? So I finished what I had to do and like, oh, let's go golfing. So I started getting bigger cases, and I had a prosthodontist as one of my clinic advisors who would sit in the clinic with me, and he would just sit there the whole time, just with me. And he wouldn't help me, but he would just sit there and tell me. He was a Navy pros guy. So he would just tell me all the debauchery stories about being in the Navy. And then he'd go, you should do pros. Have you ever thought about doing pros? I'm like, no, I'm doing ortho. But you know how it is. Everybody wants to do ortho and these other specialties, and nobody, like zero people, want to do pros. And I did like what I was doing. And it was unique because everybody wasn't, like, nobody else wanted to do it. And so I thought, you know what, maybe I'll give it a look. Because the pros program at Washington at that time was amazing, because we had we had Ralph Udalis as the head. We had all sorts of amazing out of house faculty, Frank Spear, John Coyce, Vince Kokich Sr., Dave Matthews. I mean, you name these people, and they're the who's who, and they are all part of the out of house faculty. And so you go, okay, so this maybe is a good landing spot. So there I was at pros.
Well, kudos to you, man, because I'm kind of jealous now, because that's definitely where I would have headed. So I still say the one that I've always said hell no to, and I still say hell no to, is ortho. And not that I don't like ortho, but I want somebody else to handle it, and I'll come in and fix it.
Oh, that would have been endo for me. So.
Oh yeah. Well, endo. I applied to endo, so yeah.
I have a very crude saying for endo. We'll say offline, but that was just not going to be for me.
We have a couple of daughters in dental school right now, and one of them did a gap year, spent it with us in the practice, and I think she wants to do pros. Like she saw what we do and she's like, yeah, I want to do that. And I'm like, oh, are you sure you don't want to do ortho or perio?
We're gonna get an orthodontist in this family, by George.
Now, pardon my ignorance, but is Jill a prosthodontist too?
She's not.
She's not. Okay.
She just plays one in the practice, but she's
okay.
Not.
Well,
Yeah.
hey, you know, that's pretty fantastic. But there's a huge need for prosthodontists in the world, and I think the general public misunderstands that. But you know, it takes us to educate them as to why there's a need for that. So kudos to you, man.
Thanks.
So.
Greg, you touched on something.
Greg, you know what's interesting though?
Oh, go ahead.
Yeah, go ahead, Jeff. Jennifer was talking, but cut her off.
You go, JB. I'm sorry.
Well, he touched on something really early, and now we're just going knee deep into dorkdom 101 here, because it pinched a nerve for me when he said, now that we're seeing ortho and airway and how all these disciplines are coming together with pros. And I had received this very long email from an orthodontist not that long ago, sort of kicking back at me a bit. He was praising me for reading his correspondence and for being proactive for my patient. So it was kind of a sandwich technique, like, good job. Most doctors don't even read the correspondence I send. But then when you kicked back on the multiple extractions and all the other things that we were proposing to do, and then he cited a bunch of literature about how there's no correlation between airway and what we do in the oral cavity. Anyway, so it touched a bit of a nerve, because I thought, am I really that disconnected? Do I not really understand the physics of how the oral cavity works? I feel like I've done a fair amount of continuing education to understand it better. Would love for you to spend just a few minutes talking about the connection between orthodontics, not that it's your specialty, but orthodontics and airway and function, and how that then parlays into the prosthodontic world and what you see long term. Because I think for me, I'm always thinking, yeah, but I see this patient at 40 or 50. We're having to sometimes go backwards and undo maybe what we set up early on.
Yeah, it's a challenge. And again, when I talk to dentists around the country about creating their interdisciplinary team and trying to teach not only towards aesthetic and functional outcome, but for a healthy patient outcome, I say the challenge that you're going to find is finding an orthodontist that actually understands and sees the light, because it's not taught in schools. I mean, you guys know this, the literature drags. To get the studies that they are looking for, probably never will get them to the level that some of these institutions may need. And it's true that taking teeth out doesn't cause the airway issue. It's the cause happened before that.
Right.
It's necessitating the need to take teeth out and get them over the ridge. But there is so much benefit from an ortho standpoint to our restorative patients. It's crazy. I think most adult patients can benefit from ortho. I think the biggest needle changer for health is the airway piece. I mean, the last thing I want to do is restore patients. I mean, that's what I was trained to do. I was trained to do these big rehabs, but that's the last thing I want to do. Mm-hmm. And I think if we utilize the benefits of surgeons and orthodontists, we can put teeth in a better position from a functional standpoint, a structural standpoint, and I get a health benefit. And then the dentistry becomes easier and it becomes way fewer teeth. So that's why I'm like, one of these girls needs to be an orthodontist to come in, and all of a sudden we have our own in-house orthodontist.
Multidisciplinary group, right?
Yeah, exactly.
This is really a good business plan.
To JB's point, and actually you actually, it was great that I stepped on you, and I'm glad that you got to speak first, because this really leads into exactly what I was going to say, which is that I think had you gone to ortho, you'd be having to unlearn everything that you were taught, because the vast majority of the orthodontic community really, they're the last ones to kind of grab on to the newest research. And I'm not trying to diss the orthos, because there are a lot of great enlightened orthodontists out there. But I will tell you that even at the American Academy of Dental Sleep Medicine and some of the other functional meetings, that very often the orthos will come in and they'll present very outdated research to justify the fact that, you know, all this airway stuff that we're talking about is really unrelated to anything orthodontic. And I'm like, you know, this is not, it's not a turf war. This is a how do we work together to make people healthier kind of thing. And so, you know, it's almost like I think you picked the right thing to do, because had you gone down the ortho path, I think you'd have had a harder time getting to where you are now.
It could very well be. I just think everybody needs to be open to hearing another version of what they believe, right? This whole idea of confirmation bias, that like, this is what I know, this is what I was trained, this is what I've read, and that's the only way everything happens, makes no sense. I mean, we are learning different things every day. And I mean, just with us, right? As a restorative side for all of us, if you think about what you were trained to do in school and what you do now, it's nothing like it, because you've been open to learning as knowledge has grown and technology has grown. And I think that should be the same for all disciplines, because it's really for the betterment of the patient. I mean, that's really the end all. We're trying to make better people, smile, function, health.
How did you get involved with the SPEAR education group, and what's your current role? And tell us a little bit about just the general educational philosophy there.
Yeah, so it's interesting. So as I said, we got a lot of information from Frank and John. That those were our two mentors when we were in
By the way,
grad
can we just say how crazy it was that they were together at that? That's like
I know,
Isaac
right?
Newton and Einstein being in school together. You know,
Right.
just
We used to sit around, you know, because you were just a cheap laborer. You do all your lab work. You'd sit around and you'd be doing work, and so you play hypothetical games like, oh, if you had, you know, like one place you could go practice, and it was like, you want to go practice with Frank or you want to go practice with John, right? That was it, because those are the two guys that were like on the top of the world. So everybody had their rationale and their reasons as to why they chose one or the other, and I said, I'd go with Frank. So end of second year, we used to do all sorts of these seminars with the ortho perio students, and I come down from a seminar, and there's a note on my desk that called Dr. Spear back. And I'm like, well, that makes no sense, because I'm not the guy that, you know, busts his balls to get him to come lecture for us. I don't know why he's calling me. I call him, he's lecturing somewhere. I said, you know what he wants? And he says, no. His front desk says no, but I know he talked to this person. And then he wanted your contact information. So I'm like, all right. So I find that person out. Anyway, he thought I was planning on leaving the state, because there's an awful lot of prosthodontists in Seattle, because they come and they like the area, so they stay. But anyway, I was going to stay. And so he had asked me if I might want to come practice with him. So I was with Spear Education before it even was Spear Education. I came in with Frank when I finished my training back in the late 90s, and then started kind of teaching with him then in a very small role, more like a hands-on apprenticeship role, if you will. But then kind of grew into where I am now. So to date now, I'm because Frank's not really teaching so much anymore. He's not practicing anymore. Not really teaching so much anymore. So I'm the chairman of the faculty, so faculty chairman, and the director of clinical content and campus education. So I'm full-time faculty, teaching a bunch of workshops, and then I practice as well. So I've got a lot of things going on. But it's most fun to nerd out and talk to people who love dentistry, like all of you.
Oh, is this about dentistry? I'm just kidding.
So it's funny. You were talking about something earlier, the three of us kind of were, but we were talking about ortho and pros and, you know, kind of putting the teeth in the right position. And Gregg said something interesting about there's fewer teeth to work on. In the past couple of years, I've had two specific cases that I was just like, you know, there was a patient that was occluding on her incisive papilla. And both of them were pretty close to it, but it was just such a deep bite, such a horrible bite. And I was like, look, before we even talk about restorative, we've got to get these teeth in a healthier position. And I said, right now they're not. And I said, and I'm not even going to treatment plan you until you're done with orthodontics. And both of the patients went through with it. So anyways, they both finish orthodontics. They get the teeth back into the perfect position, and there's not a damn thing for me to do, you know? And it's just like, if you want to do something right now, it's purely cosmetic because everything is repositioned perfectly. You didn't have an excessive amount of wear. And I was like, the orthodontist just took everything that I possibly could have done out of, you know, my wheelhouse. And I said, but I'm happy and you're happy. And I think you're very, very functional now. And it's amazing how much better it makes the patients feel. So maybe that's why you wanted to be an orthodontist, Greg. You'd have work all the time instead of half the time.
Yeah, I mean that's such a great story. It really is, because for whatever reason, and I hear this all the time, that people believe that spear education is all about these big rehabs. Oh, if you want to go learn how to do a rehab, you go there. That is the last thing I want you to learn, right? Because if you put teeth in the right spot, you can make patients more healthy. You do more predictable dentistry. You do less dentistry, but you're helping patients in a whole new level. So you know, in the past, I would say yes. In the past, before it became spear education, it was about rehabs because we didn't have this interconnectedness to know how to do these big ortho cases in ortho surgery and expansion and all these things. So in order to get room to restore all these worn teeth, you had to do like rehabs. So yeah, back in the 90s, sure, but we're way beyond that. And if you have this interdisciplinary team and you have an eye on health as well as aesthetics and function, there is fewer teeth that we have to touch. But if you do have to touch them, they're more predictable because the etiology's been addressed, and all of a sudden your dentistry is going to be more predictable from, like, it's not going to fail as much, it's not going to fracture as much. I mean, that's the piece that dentists struggle with is, oh, these big wear patients, they're going to destroy everything. I'm just going to over design it with super strong monolithic materials and just make it crazy for the next dentist. And in reality, like, if you just treat the etiology, your dentistry can be predictable and doesn't have to be over designed.
So to that point, I want to let me ask this question, because to that point, because I want to hear about what spear education is doing now on the treatment planning front, as far as educating on treatment planning, because you know, in dental school, and I think you and I are pretty close to the same age. Chad's a few years behind. Jennifer is like a child,
A baby.
a baby.
A wee baby.
But the way that we were typically trained, and of course your training is different with specialty training, but you know, it was so departmental. It was so compartmentalized. It was so, I'm an airway dentist, so I'm going to treat the airway, or you know, I'm a TMJ guy, so I'm going to treat the TMJ, or I'm a, you know, ortho, so I'm just going to do ortho. And even just today, I had a patient came in, 30-year-old pilot, FAA exam, you know, has sleep apnea. They're really pressing them now, which is great on getting tested. And he comes in and he's got a scissor bite. Like, that's how narrow his arches are. And he's there to see me for an oral appliance. I'm like, dude, you're 30 something years old. Let's get in here. Let's do some surgically assisted ortho. Let's get you expanded out. I mean, his airway didn't look that bad, other than the fact that he had an airway problem as a kid, didn't develop properly. Yep. Let's do that now. And so my question to you is what is spear education doing now to help create really well-rounded, good treatment planning dentists?
That's a fantastic question. And I think the difference with spear education is this: we're training dentists to do dentistry. That's it, right? But in that, I mean, I think you guys have had Jeff Rouse on here. Did Jeff come and talk to you guys?
Yeah.
Yep.
Yes. Fantastic talk.
You know, Jeff and I have known each other a long time. We decided we should work together at one point. So he actually commuted, I don't know why, but he commuted up to Seattle, and we practiced together for nearly 3 years. Just, you know, couple weeks every couple months. But it was a nice way for us to learn from each other and see things through each other's eyes. And I got a really good appreciation for how he was viewing the world, which is where we developed the Seattle Protocol and these types of things. But in reality, we're teaching dentists to do dentistry. That being said, if you think about it, and I said earlier, treatment planning is the most important thing that we do. If you understand, so all dentists struggle with the same patients from a planning standpoint, right? You have wear patients, you have edge-to-edge bites. You know, as Chad said, you got deep bite patients. All of these patients are a struggle to treatment plan because you lose things that you need. You don't have room to lengthen teeth or restore teeth. If you understand the science and the literature behind it, knowing that when structurally things are not exact, the airway implications, if you just treatment plan to do more idealized dentistry, you get a healthier patient at the end. Whether you use the words airway or not, if you understand the science, if you normalize the maxilla that it's too narrow or it's set too far back or it's sitting too far down, if you normalize the maxilla, patients will get better. So the treatment planning is just treatment planning. It's just dentistry. So dentists don't need to be an airway centered dentist. I mean, great. If you have an eye on that and you have a passion about it, fantastic. But you can just still do dentistry. Know, though, that how you treatment plan the dentistry will impact the health of the patient. So to me, it's a really exciting time to be a restorative dentist because we have the ability to think differently and to help patients differently. Like I think, listen, I still want to be an orthodontist kind of in the back of my heart, but I think what we do as a restorative dentist is great. Because we get to make calls and move people in the right direction and have wonderful conversations. And then we get to be the last people to touch the patient and end up with these beautiful results that people say, you know, as JB said, you changed my life. Like, you changed my life. The way you thought about the case, the dentistry that you did, the treatment that you recommended, I'm forever grateful. Like, all right, we're good. That's fantastic.
You know, it seems like we're kind of stuck on this airway thing, but I'm going to go ahead and throw it out there one more time, just because it hasn't been beaten enough. I was talking to a residency director for an ortho program, and they believe that airway is a bunch of BS. And I've talked to other orthodontists that are in complete opposition to that statement. Do you feel that taking one of these courses at Spear would be beneficial for a restorative dentist and an orthodontist to take? Because I truly believe that the world is lacking in orthodontists that are responsive or, or take into consideration the airway.
Yes, 100% yes.
Okay.
So I know we're going down this rabbit hole of airway, and so for people that are listening,
it's so important though, and I don't think we knew it 30 years ago.
It is, and we have a passion. That's why that's why we're ruminating on this. But I want to make this little caveat here, in that Spear Education treatment plans with the idea of health and airway. When we first started doing this, we had the same passion that I'm seeing from all of you guys. Like, we were all in dentists who came to learn how to treatment plan and do more comprehensive care were like, oh God, I'm going to do that. I want that. And then their patients didn't want to do the recommended treatment. And so they were like, well, then I'm not going to treat you. And we were like, whoa, wait a minute, let's back up here. At the end of the day, we're dentists, right? We got to do dentistry. So we started speaking about it differently, like airway directed planning versus airway aware planning. Our goal is to help the patient in as many ways as possible. Patients, though, even after being educated, sometimes don't choose maybe what's best for them. They just, I just want to look a little better, and I want to replace these teeth and they're worn, and I want to. Okay. So in the treatment planning, if you know the big picture, if you know the health and the airway piece, just don't make them worse.
Yeah.
Keep them stagnant, right? Keep them stagnant or make them better. And honestly, if you know how to treatment plan, you don't even have to use the words airway, because, Jeff and I have this discussion all the time. This is one of the first things we say. Airway treatment planning is skeletal and dental alveolar treatment planning. Put the skeleton and the alveolar housing in the right spots. And if you reverse engineer the science, the patients are going to get better. But it's really just treatment planning more idealized. That's what it is. So I just don't want to do dentistry that might make a person less healthy. I'm happy keeping them here. I'm even more happy if I can make them better, but I still have to do my dentistry. But understand that when you do your dentistry, if you actually make the airway better, you're actually making your dentistry more predictable as well. So it's like a win-win for everybody.
I love it. I love it. And I had a case a couple weeks ago that I sent to the local prosthodontist, and I've worked with him for as long as I've been out, so 25 years. He was one of my directors. He was in his residency while I was in dental school. And I was like, I'm really worried about an airway issue. And he responded, I'm on it. He says, I appreciate you finding that and bringing that to my attention. And to me, that was just huge, because I was like, all right, man, we've crossed this hurdle together. We've actually realized that this is a problem that we need to address. And I know Jeff would be very excited, because I think Jeff was a co-resident with him. But yeah, it was really cool. And I love what you guys are doing. I think that's fantastic.
Well, we have a lot of fun. Jeff and I in the treatment planning workshop have a lot of fun, back and forth. We kind of like split the class up where he's with them and then I'm with them, and we just kind of go back and forth. But it's interesting. We were both trained at different times and at different places, but our goals are the same, and our thought process is eerily, and the way we do things is eerily similar, which is fantastic. But crazy when we started working together, like some of the things that you go, oh, I shouldn't do it that way. I shouldn't wait so long. He's like, oh, I do the same thing. I'm like, whoa, what's happening? It's like we have a similar goal, similar passion, and I think we're a good fit when we start teaching classes together. So it's a lot of fun.
That's a lot of young docs, or maybe not young, but early career docs who are always asking, like, which program should I choose? Why should I go this route? And one of the advantages I perceive from SPEAR is this collective group of individuals coming with different expertises, sort of looking at the holistic treatment plan. Talk a little bit about that journey, the curriculum of how, a new doc kind of gets engaged into SPEAR education and what that path might look like for them.
Yeah, great question. We've seen a real change in the dentists that come. Initially, when Frank was doing this, it was the dentist had been in practice, 10, 15, 20 years. And it's like, I made the mistakes, and it's, I want to do, like, it was inspirational and aspirational. Like that was like, it was the top dentists who want to do the top tier. And now I look at it, and it's completely changed. It's the younger dentists, and there's kind of two reasons why they're coming. This is what I ascertained from their introductions. They either come because they're new to dentistry, like right out of school. I mean, that new. They have a senior clinician in their practice that says, hey, you got to do this. If you want to get on the right tracks, do it now. I waited too long. Like, do it at the beginning of your career. That's one piece. And then we have dentists who've started their career, and they're starting to get burned out. Maybe they've been in dentistry 5 years, but they're single tooth dentists. They're treatment planning teeth. They're a tooth dentist, and they're going, oh, I'm just burned out. Like, it just kind of sucks. And so like I'm looking for a new way to evaluate and help patients. So it's kind of a different clientele than we used to have.
Has that been advantageous for you all? I mean, I would assume it's actually probably nice to have early, mid, and maybe mid to late career dentists all sort of commingling together, learning. And
it's great. I've never had anybody come in and go, "Oh, I did it too early. I wish I would have waited."
yeah,
No, they come in and go,
yeah.
I wish I would have done this earlier. And so now you have all these, right? Dentistry can beat you down, right? Dentistry can make people very angry and very cynical. It's like, fuck this. I don't want to do dentistry.
Exactly.
So
100%.
yeah, it's easy. It's easy to see how dentistry is such a challenging thing. These younger dentists that are coming in are so excited and passionate, and I think that I love it because you can feel that energy. Like they want to help patients in a different way. They don't want to mess things up. They don't want to go. They don't want to like. Somebody was just in and said, "Oh, I've done, I've done 5 rehabs, 3 of which were great, and 2 I don't want to talk about.
Yeah.
Like, I don't want to go down the roll with those 2 anymore. So I want to figure out like what happened and why did I do it? What did I do wrong? What should I do better?" So it's really fun to see this newer, younger group of dentists because they love it. They still love it.
Small testament to this shit dental education system we currently have, but that's another topic.
It's the same.
Sorry,
we see it the same way though with the girls in dental school. Like they're doing the same things that we did, right?
What the hell? Like how have we not evolved from now?
I know. Well, you got to treat people they got to learn how to fix a tooth.
Yeah.
I guess that's the take home.
So in your defense, Greg, as to not being an orthodontist, one of our viewers tonight, Dr. Seth Atkins, who we all saw speak so eloquently at the AARD this year, he said the current ortho practice model doesn't allow the time to adequately diagnose the airway and joints. Got to be the restorative docs prior to the referral, and I couldn't agree with him more. I mean, I think it's our job to notice those issues and point those issues out, but good God, I'll say it 100 times. I'd love to have an orthodontist that really respected the airway. And I think I got a few in our area that are really working towards that, but it's a collaborative effort.
And the joints, Chad, and the joints.
I agree. It is
such a struggle. It is such a struggle to
I agree, Jeff.
That.
I agree, Jeff. And with that being said, one of my golfing buddies, Dr. Jose Chow, he respects both, and I think that he'd be a great guest to have on. So we'll get him on here. But
love that.
Yeah, it's just it is a struggle. It's really a struggle to do it, and I love that you guys are focusing on that. So
there's so many pieces. I mean, joints, periodontists, orthodontists, oral surgeons, like it does take an interdisciplinary team. And I think that's one of the things that Spear has done extremely well, because Frank has always been well-versed in this interdisciplinary type of education. He himself, Vince Kokich and Dave Matthews put interdisciplinary dentistry on the map, right? It was perioprost that, Penn had it, BU had it, but the 3 disciplines, those are the 3 guys that kind of put it on the map. And I think that's kind of what we've carried forward, but increased it with the idea of airway, with joints and Jim McKee. We brought Jim McKee in, and we have Rebecca Bachau for ortho and Mike Gunson for oral surgery. Like, we've got some really good people to help keep the whole concept of treatment planning alive, helping patients.
Where would you recommend, there's a lot of people out here. I mean, I've taken a couple of courses at Spear, and the more we talk with Ashley and Spear, I can't wait to get out there again. But where would you suggest that people start? Is it a local study club? Is it coming out to the center and doing a course? I mean, for somebody who's just let's talk to the younger dentist. Where would you suggest that they start?
Yeah, I mean, I'll tell you what, dentists are strange. I mean,
no shit.
That's the understatement of the year.
Hey, there's 4 of them here that can attest to that.
Yeah, it's like, preaching to the choir here, but we make decisions differently than other people, right? We've got to like totally be invested in, like, if I want to spend money and learn something, I got to really know that like this is the place for me. So study clubs are great because you get to learn a philosophy and you get to learn concepts. Even the Spear Online library, there's such a vast library of information. If you learn what it is that kind of works for you and you want to implement it into your practice, a hands-on workshop is the only way to do that, right? We can say we're digital dentists, but at the end of the day, we're analog dentists. I still got to work with stuff with my hands and prep teeth and put stuff in. So the reality is a hands-on workshop where you start doing activities that you will have to do in practice, that really is the way to implement it into your practice. But I know how dentists work. You're not just going to pull the trigger and drop a bunch of money because someone says, oh yeah, you should do that. You're going to say, well, I don't know if that fits for me. So you're going to, study clubs are a great way to see if it fits. And looking online at the Spear Online library makes a great way to see if it fits. But when the rubber hits the road, to implement it and change your practice, you got to do it. So the hands-on workshops on campus would be the way to do that.
And I have seen the fundamental change that happens with doctors when it's that light bulb moment. And to your point, when you've talked about doctors who show up there who are frustrated, even if it's the 5-year doc or the 20-year doc or the 30-year doc, and they're frustrated with the cases that come in that they can't solve, or, that one tooth that every time they bite on it hurts and there's no obvious sign of fracture. And, you sit through those courses and you replay every single one of those cases in your mind. You're like, that would have solved that particular problem. That would have solved that particular problem. There's so much empowerment that comes from that. And then you're collectively building a group of individuals around you who are also participating in that same light bulb journey with you. There's so much power in health, mental health that happens in your professional growth when you participate in that type of education.
Yeah, it's energizing. We get siloed into our own worlds. I mean, Dennis, you can be in a group practice, but you're still like, it's just you.
Yeah.
Getting out and actually interacting with other dentists who also have this passion, it just feels better, right? And then you go back and you're jazzed, and then you help patients, and so like it's just a continual cycle.
Mm-hmm.
Better yourself, better your patients. At the end of the day, everybody's happy.
Yep.
Well, Gregg, it was awesome. We're actually over our hour, but I could go all night. So, one
That's
question for you before we close.
Sorry.
Are you still golfing?
You beat me to it, JB.
You're full of shit. JB.
That's fantastic, JB.
That's
Sorry.
my middle finger.
I mean, it was a softball.
But
Gregg, are you still golfing?
I am. Maybe Chad. Maybe we should talk at the Restorative Academy and then plan a time to
No,
hook up.
I'm going to come to Scottsdale. That's already in the works. I'm actually talking to him. So I'm going to come to Scottsdale. We're going to make it work to where maybe we can figure out a weekend where we can play golf and then do the course and all that stuff. So
that's great, but easier to come to Seattle, and I'll host.
I have family there too. I can do that too.
There you go. Now it's a done deal.
We'll be in touch. But as we close tonight, I just want to say, this is something that I say in every presentation that I give. Do we just want to be tooth mechanics, or do we want to be physicians of the oral cavity? And I think that the moral of this story is that we are not tooth mechanics. We truly have the opportunity to be physicians of the oral cavity. And that includes the joint, that includes the airway, that includes the dentition. And so with what Spear is offering, we can bring all of that together to improve a patient's not only health, but when we improve their health, we improve their life. So, Gregg, thank you for what you all are doing at Spear. I can attest to the fact that Spear not only teaches you well, but they feed you well. And it just so happens to be right across the street from like one of the best courses in Scottsdale. And there's also, I like to go for a jog when I get out there, because you can go run around the Lamborghini dealership, the Ferrari dealership,
Dangerous.
the Porsche dealership. You can look at some pretty hot cars too while you're out there. So Everybody needs to make a visit to the Spear facility. I will be out there. I know that, and I will say that for a fact. JB, we've talked about it. Let's do it. Let's get out there. I love what you're talking about. So thank you so much, Gregg. We really appreciate you, and we appreciate Spear Education for being a sponsor of the show.
Well, I appreciate the time. It was a pleasure to speak with all of you. I love the passion. I love what you guys are doing. Keep it up, because you're motivating everybody to be better. So it's great. Thank you.
Thank you very much.
Appreciate that. Yeah.
All right. Well, with that being said, I don't think there's much more to say, but good night, guys. We appreciate
Good
you all.
night, everyone.
Have a great night.
And thanks, Gregg.
Thanks.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.